I'll just introduce the session and say good morning again for anybody that wasn't at the earlier session. Good to see you all. I'm June Chandler and I'm introducing the session that Michelle England is going to present on adopting a just and learning workplace culture. Michelle is a branch secretary and a staff side lead at Pennine NHS Foundation Trust, and she's going to give a talk about her work with the employer to adopt a programme of change within the trust to move away from a blame culture to one of openness, fairness and learning. And she'll explain how this project came about and how it's already showing tangible improvements in terms of staff morale and motivation and a sense of staff feeling valued and supported. And as Richie said, the session will be recorded and circulated to you by email. We'll also be sending you a CPD certificate for each of the sessions you attend today. So before we start, just a reminder, if you can all mute yourselves, please. If you have questions or comments, please use the chat box. We'll be monitoring that throughout the session and we'll put those questions to Michelle at the end. And hopefully there'll be some time for discussion and contributions. If there's anything that occurs to you after today's session, then do contact us on baotstewards.co.uk and we'll get back to you. And I'll now hand over to Michelle. Thank you.
Thanks, June, for that. So I think there'll be some people on the call that do know me. When I first said that I'd come along and do this, I was hoping for the social and the face-to-face, just to see everybody again. It's been a couple of years since I've seen people face to face, but I think that's the same for all of us. So for those who don't know me, my name's Michelle England and I'm a branch secretary in the North West. Pennine Care, we're a health and learning disability trust. I'm also a regional healthcare committee chair in the North West as well, and I used to be the OT panel chair for a few years until I stepped back away from my clinical role and into more of a staff side partnership role within my trust. And I'm coming along today just to talk about adopting a just and learning workplace culture, something that we've been doing now for a few years. If we could pop on to the next slide, and I try not to sound like Chris Whitty, see. Oh, I didn't think that was going to work then. So I think that if we were all together in a room, we would be able to have a discussion about this. You know, what is just culture? Do anybody here, have you already heard of it? Do you do anything, like this in your trust, clinically or workforce wise? And it would be nice to have a conversation with everybody around that, really. Because the first time I heard about just culture was actually at Unison Conference, probably going back, showing my age, probably about 2005, 2006. And I know there's probably going to be people in this room that were at this session. And it was the BAOT Fringe event, and someone came along from aviation and was talking about just culture and around that non-apportioning of blame and how the aviation industry has changed about the way that it looks at issues to make aviation safer. And as I say, that was going back quite some years. And it's always something that kind of stuck with me. So when we started looking at it in the trust, it kind of took me back to those early days. If we were fitting that, I'm back here talking to you now. So this definition that I've got is from Professor Sir Norman Williams, and he wrote a report that's all of this information's on the NHS England website, and at the end there's a slide with the references on, and some of the slides are a bit difficult to see, so we'll be sending them out as well to you, so you'll have all the links to these reports. But they say just culture considers a wider systematic issues where things go wrong and enable professionals and those in the operating systems to learn without fear of retribution. And I think that's a really important point. Within the trust, we've never really been able to find one definition that covers what we want and what we mean by just culture. There's always quality wanting to lean towards them, the clinical team want to lean towards them, workforce wants it to lean towards them. So there's always we ended up having a subgroup that went off to discuss that, because it was just taking over whole meetings, just talking about what is it, let's get this down on paper. And I think for me, it's around looking at the what happened, not who it happened to. And I think that as we go through the slides, that'll become more apparent. I think in Just Culture, investigators principally attempt to understand why the failings occurred and how there's a system led to suboptimal behaviours. But it does hold people accountable when there are evidence of gross negligence or deliberate acts. But it's about that. I think we've all been in, with members who were just at the wrong place at the wrong time and they made the mistake. Sometimes you look at, the area they're working in, and it feels like they were all just passing around a bomb and they just happened to be holding it when the music stopped. And if we don't learn from that, the next person's going to be sat in a disciplinary about the same thing. There's quite often lots of systematic failures that lead to a mistake. It's not about the person always who makes that mistake. So if we can move on, Richie, thank you. Okay, so I know this is really difficult to see, and we are going to send this out separately, but you can find this on the NHS England website. And this is just one of the guides that's out there. If you Google it, you'll find them. They basically say the same thing, but they're all different types of flow charts, and people have tried to make them look pretty. And I think that this guide, it's supposed to support conversations with managers. It does look, this is very much centred on patient safety issues, but we use the idea with this in all incidents throughout the trust. And the very first question in it is there an intention to cause harm? And there's lots of debate whether that should be the first question you ask or the last question you ask. And you can look at it kind of either way, I think, for all of it. But that's the first thing. Did this person actually mean to cause a deliberate act? And then it starts to look at, are there any health issues with this person? Are there any mental health issues? Are there any indications of substance abuse? Is there anything else that's going on in this person's life that's led to this? And also, are there agreed protocols in place? Is there a system that's behind this person that's let them down? So I think it's just a way of starting to have conversations, and I think that's one of the big things for us throughout the organisation, that we constantly say it is about having conversations. It is about people talking to each other, and sometimes that feels extremely radical. That people have conversations around what happened rather than just decide and apportion blame. We could move on to the next slide. That'd be great. Sorry, I'm a little bit croaky today. I got pinged last night from my plane journey over a week ago. I had to go and have a PCR. So I spent all night last night thinking I was croaky because I got COVID from a plane journey. Anyway, it's negative, so I'm all right. I'm just croaky because I'm croaky. So our journey in Pennine Care, there was nothing that started this, really. There wasn't a big bang moment. There wasn't some big scandal. There wasn't a massive patient safety issue. Merseycare in the Northwest, they were one of the first trusts to really champion Just Culture, really kind of champion the idea about this. And then they kind of since then turned it into a bit of a business. But they did it coming from a workforce angle, because the amount of money, they were spending millions of pounds on suspensions a year. They had workforce issues going through the roof. It was just so they brought this in for that. When Pennine Care brought it in, it was very much about clinical safety. Just that we'd got new board members, a new chief exec, and actually they just came in with new ideas, and that's where that came from. So no big disaster, no terrible things happening that made us change our culture. Just a view that we could do better, and this was a way of doing it. So we had quite a big launch event, and we had a gentleman called Dr. Bill Kirkup who came. Now, he was appointed chairman of the Morecambe Bay investigation in 2013. And he'd also led investigations into the Oxford Paediatric Cardiac Surgery Unit, and most recently the Jimmy Savile's involvement with the Broadmoor Hospital. So he was, he was the author of the independent investigation into the Morecambe Bay Trust. So he came from this from a very much an investigating patient safety incidents, and as I say, it was very much a focus on clinical incidents. The trust said to us as staff side, "Oh, we're going to do this big Just Culture event." We went, great, and we got there, and it was just all about clinical services, and we were like, well, hang on a minute, why are we not using this for everything? The culture needs to be a culture. It needs to be across absolutely everything. And every table we had a staff side rep on, the feedback at the end was, this needs to go across. This can't just be about patient safety. This is too big. It needs to be workforce as well. And we piled on that pressure really until the trust kind of was like, yeah, no, actually we can't investigate patient safety issues like this and then have a completely different approach for disciplinaries. So we kind of worked with them and got them on side, and they became a kind of a workforce subgroup of our overall Just Culture meetings. And we had a big event planned in April 2020 with Dr. Michael West was coming, who does a lot of work around developing cultures of high quality care and inclusive leadership, which is like the new thing to talk about at work. Is inclusive and compassionate leadership is the buzzword at the moment. And he was coming along with this big. They thought it was a big coup that we got Dr. Michael West coming. We had a massive event, and then obviously COVID hit. The event got cancelled. I think it was only about a week after lockdown that this event was planned, and things stopped for a little while, as did everything else. But within our subgroup, within the workforce subgroup, we really felt that couldn't be. We didn't have to meet face to face to do some of this work, and we could push on with that. And we're not as far on as we wanted to be. That is absolutely true. But we pushed on, and we've started to make a difference in our policies, and I think that's been a testament to really people wanting this to work rather than it just being staff side pushing. I think it's been a group effort. My worry about it just being us is that, and I'll probably say this a few times, but policies don't make a culture, and you have to have everyone on board. So that again, it has to be the whole trust that's working in this way. So that's where we how we got to kind of where we are today. So if we could just move on, that's great. So just going a little bit left field at the moment, but Just Culture at the movies. I don't know if anybody's seen the film Sully, Miracle on the Hudson. It's quite a good film, and it's about for those who haven't seen it, the emergency landing of a US Airways flight on the Hudson River. The plane took off, got hit a bird, had a bird strike. The Captain Sully, he ended up working out they couldn't get back to the airport, and he landed the plane in the Hudson. All passengers, crew survived, and he ended up in a situation where he could have lost his career because of the investigation process that then went on. And one of the interesting things about the film is that in his bag on the day of that flight, he had the book from Just Culture by Sidney Dekker. He had that in his carry-on luggage which was a really random thing. But actually that book saved his job, because throughout the film you see him turn the investigation from it just apportioning blame to him, to using a just culture model to prove that actually the way that they'd simulated him, they said he could get back to the airport, he said he couldn't, and looking at that differently, he proved that actually he couldn't have done, and his actions were right, and they saved everyone on that flight. So if you have seen it, or if you haven't seen it, it is worth looking at again, because I think it gives you a really good example of how a just culture does work throughout, throughout all services, and it just gives you a different perspective sometimes of it. So it's something to have a look at. I'm sure if we're all in Warwick, we'd all be there. Instead of going to social, we'd all be downloading it and watching it. So, but yeah, it's just an interesting thing. You don't often talk about something that's been in a film. So I thought I'd just throw that in. So if we could move on, that'd be great. Thank you. So workforce policies. So just talking about what we've done really, and what we've changed, and how we've tried to use this to make our policies better. So there's a lot of this that I was really sceptical about, and I still am some of it. Again, I'm a great believer that you write a policy and it can affect some, but I find that people don't read a policy until they need it. So they don't read a policy, be inspired by it, and go out and follow that. So I think we were on the same path. It's most of the time, the partnership working, there's a real push from our HR department and from our staff side that are all on the same side with wanting these processes to work. So if we could move to the next slide, Richie, that'd be great. So the first one that we looked at two together really, was so the first one was grievance, and I think just the word grievance has different reactions from people. I think some people they feel that they've got to be really angry. They've got to be really angry about something to take a grievance, and not just because it feels like it's such a formal part of the process. And what we found was that people weren't. You see, Mike could have been there watching it tonight, wouldn't you, Mike? While you were getting ready. So we renamed it early resolution policy, because actually what we want out of grievances is to resolve issues. We don't want them to go to big hearings that are stressful for everyone. We want to try and resolve them. And actually, the other policy that we had was just standing in the way of that. So the first part of this policy was always informal grievance, which sounded great, but we've changed that now to request for resolution. Now it stays informal, it's still the informal part of the process, but it now allows representation in those meetings. Our old policy, and HR views as well, looked at anything that had HR and trade unions in as a formal meeting, which really in a lot of cases stopped that process, and it stopped any hope of resolving formally. The managers didn't like it, and their advice to our members would always be, I tell you what, why don't you take this formally and get the trust to look at it properly, rather than, right, let's see how we can sort this out. And I think there was lots of reasons for that. Some rubbish managers, some tired managers, some overworked managers, and not having that support really from HR, which they do rely on. So it was very much pushed, and they could get away with saying that because I wasn't there, trade union wasn't there, HR wasn't there, saying, no, actually, I think we can resolve this at this point. So, that's been quite a big move, really. And I think there was also a barrier for our members as well, because they, especially if they're the manager was slightly involved in this. They felt uncomfortable sometimes being quite open without that support there. And you know, HR did push the narrative early on that if they were there and trade unions were there, it was automatically a formal process. And I do think that was a real barrier into sorting things out quick and timely as well, because I think there's a time limit on this, isn't it? The more even small issues, the longer they go on, they become bigger than they are. So it's about trying to get things sorted out at a really early level without having to go through that. And then if that isn't able to be done, because we know some things are not able to be done informally, that next meeting was changed to a resolution fact finding. So again, that push on resolution, that push on trying to sort that out. You know, prior to that, the outcomes were actually pretty lame, and they didn't always do enough to resolve the issues, because if the member didn't ask the trust to do something, they might say, well, we've upheld your grievance. And they say, well, what are you going to do about it? And they say, well, you didn't ask us to do anything about it. We've flipped that on the head, and now the actual finding a resolution is the most important thing, rather than people just having their say. So we've tried to move that quite a lot. So yeah, that's the grievance policy, and the next slide is the next one that we looked at pretty much at the same time, really, because I think that everybody that I speak to, they go, "I'll take a grievance out," and then they tell me what it is, and I say, "Well, what's the dignity at work?" and and we have that conversation. So I think that the two of them really needed to be looked at together, and in some respects launched together, because they're both very similar in our members' minds. So we changed the dignity at work to be called respect at work policy, just to kind of change that dignity, really, and understand that it was about everybody kind of having that respect. And what we tried to do is, again, we tried to front load the policies with options for people. We know that a lot of time that this policy gets used, we get a phone call from someone saying, I'm off sick because my manager's been bullying me, or somebody's been bullying me, and it's at the point where they go off sick that they want to do something formal. And actually what we're trying to do with this is to give lots of options first. What can we do? How can we make people feel comfortable and trust enough to raise issues before they send them off sick? How do we create an atmosphere that people want to speak up and be able to iron out some of these problems? So there's lots of training going on with managers around facilitated conversations, and as I say, go back to conversations, and I think it's something that's lacking when you speak to members around conversations that they say they've had with the managers. Actually, they're not conversations, somebody telling them something. And we are trying, and we do this together. You know, we do some of this training together with the trade unions and with our learning team, our OL&D teams, to try and get managers to understand the process and where we're coming from when we have a conversation with them, and where the trust are coming from, and trying to create a situation where a facilitated conversation can be meaningful, because I don't think they often are kind of at that level. And then mediation, we get a lot of people saying, oh, I have mediation with my manager, and I say, well, you don't have mediation with your manager. Mediation is a service that we offer you. It's independent from your manager. What do you mean? What happened? Oh, well, she got me and the other girl that I've been arguing with in the office, told us to sort it out, and then off we went. And I'm like, yeah, that's not mediation. And we pulled the figures from our mediation that we have, and we found out that 80% of cases in the trust that reach face-to-face mediation by our trained mediators, there's an agreement to continue to work together in a positive way, and there's no need for that formal process. 80% of people who get there, and we know there's an awful lot of people who don't get there. So that's really one of those options that comes in now at the beginning. it always used to be something that came in at the end, because there'd be an investigation and the investigating officer would say, why don't you try mediation? But it's too late then. You know, you've had months of this, you've gone through this process, people have been interviewed, people are harbouring, you know, the stress of going through that, and then you try and sit people down to do mediation. So we've pushed that to the front, and we want staff to speak up sooner. This is the policy that probably worries me more than any, because people have to see it work, I think, for it to continue to work. There's got to be some faith in this system, and I don't think that's there at the moment. And this is the one that does worry me, and how we move forward with that. Then, yeah, that's the point that I'm always saying. Well, you know, the amount of people that I get that are at the wit's end by the time they speak to us. How do we change that culture? Is that a policy? I don't know. I think that's something for us to learn over the next probably 12 months, and look at what we change. And I think one of the things that we did agree with was, normally we get a policy and it says this will be reviewed in 2 years, and no matter whether it's working or not, HR won't go near it for those 2 years. Even if something's blindingly obviously wrong with it. So we have got an agreement that these are a working process, and if things need to change, things will change. We don't need to kind of go through lots and lots of red tape to change something in a policy that isn't working. So I think those are the two kind of main ones that are really kind of being pushed at the moment. If we move on to the next slide, this has been the biggest challenge and absolutely the hardest to get right. We know what we want, but getting it down into a policy that everybody agrees with, this is where some of our problems arrive, because I think there's always, with this and absence, which I'll come on to in a bit, there's always managers who want this to be a stick. They want a stick, they want a disciplinary, they want to take someone to a disciplinary and they want to hit them with a stick, really. They don't want to make the situation better. There's just some people that for some reason some managers just seem to want that. So lots of feedback within this that I read and think, well, just you haven't got the idea of what we're trying to do when we're moving forward. And we have rewrote this policy time after time to try and get it right. As I say, we've got a clear idea of how we want it to work, and when I offered to do the session, I really did think we'd have this done, and we haven't. So what I've done on the next slide is there is a local trust that I've got, and again, it's not very easy to see, and we will send this out as just a Word document, to look at the structure that they've put in. It is very similar to what we see, and as I say, we'll send that out. But if you look at it as well, it does look at, we talked about before about the Just Culture Guide. It's the same idea as for clinical incidents as for workforce issues. The questions are the same, really. So let's just kind of pull that out. It starts with, does the incident appear to have been intentional, which is very similar to, you know, was there you know, did they mean to cause harm, and again, can it be resolved informally is a really early question to do that. And there is that flow chart. You know, is it the first time anyone's done like this? Is the protocols in place? And kind of working through. And there is much more of a about the person and about making sure that they're well in this as well. And there is a part of this that I don't like. So there is a fast track option, which is something that is not something I'm a fan of, and something that we are currently, I'd say, in discussions about. So staff who admit to making a mistake don't have to have a full hearing. They can just take a warning if they want. I don't like that. I think it flies in the face of a just culture. I think there's less likelihood of recommendations being put in place if they do that, because it's off the case, it's away, nobody's looking at it. And you know, sometimes, yes, someone does put the hand up and they make a mistake, but when you're looking at it, there's still external factors there that need to be changed. So we did put this into our adaptive process for disciplinaries during the pandemic. We changed how we did certain things. And I only agreed to it because I didn't think it would work and I wanted to prove a point. And one Unison member, which was against our advice, took that warning and then was extremely unhappy with the way that it read and wanted to challenge it, and just were a bit like, well, you've made your decision now. And I did hope by trialing it will prove it wouldn't work, and we've got that evidence now that nobody does it, so why are we bothering with it? So, you know, trying to have a fact-finding meeting that comes in at the very beginning that actually looks at all of these factors again, rather than just, I find a lot of our investigations try to prove that they did it rather than look at the mitigation of what else happened on that day. And you know, I think some of that is working. We had an investigation recently that had been focused on one person, and it didn't sound right. This person was accused of leaving early, and when the investigating officer looked at the CCTV, yes, this person left early, but so did the rest of the shift. So they were a bit like, well, why are they only picking on this one person? What's going on here? So they decided, I don't know where they found the time, but they decided to watch the whole shift. They watched the CCTV of the whole shift and found multiple problems on that shift. And you know, the outcome of that was, look, you know, this is a system failure. This is not one person going home early. There's issues across the board here, and you know, went forward as an action plan now on that ward, and those issues are getting addressed. And that was just looking at the broader picture, looking at what else was there. If we hadn't been going down this route, that person would have probably been disciplined for leaving early and possibly fraud. You know, it's but actually this was standard practice on the ward. You know, and we've, you know, not just that, but you've got to look at that bigger picture, I think, and that's the latest kind of example of something like that really working, and seeing that there's other things there. Because often it'll be us coming up with this evidence, and the investigating officer will just be looking at us and like, how didn't you see this? How didn't you look for this? So we are also retraining our, and that's something that we do jointly. We retrain our investigators into changing the way they investigate to look at that bigger picture. So we are putting some training in place for that as well. Could we move on? Thank you. Okay, so what else? Of course, you know, we haven't just changed those policies. So again, this pushes into everything that we do at the moment. So our IPDR process, it was an IPDR, it was a tick box exercise. Literally, it was a tick box. You know, people would sit and tick. And it's now called my yearly conversation, and it's really radical because we ask the managers to have a conversation with the staff. The first question on it is, how are you? How are you? How's your health? How can we support you? How, you know, is there anything that we can do support you in work. And it is supposed to be a conversation. The questions are posed so that there's a conversation, not just a yes no answers. We brought this out a couple of years ago now, and it was just at the same time, I just wanted to do this at the same time as the new pay deal came in, when they were saying, well, if you haven't done X, Y, and Z, and you've got this and you've got that, you can't go through your increment. And we were saying, well, you can't bring this in because it flies in the face of what the pay deal says. So we got an agreement that actually they wouldn't stop people going through their increment because they wanted to put out this. So we took that as a win. And trialed it, and by the end of the trial we found out the managers were liked it that much that the trial was pretty much all over the trust by the time it finished, because managers were passing it on between themselves because they did find it an awful lot easier. They found it that it was, people were coming to it, their levels were higher. Our IPDR levels are awful lot higher now than they ever have been before, and people felt like they were being taught to. They weren't just a tick box. So they, that really does seem to have worked. There are some slight issues coming back in at the moment where people are kind of saying that there's not enough in there about organisational needs, and we've put some more things in around equality and diversity and inclusion. But I think that people have got a bit too carried away with the conversation, and they've not actually read the paperwork right. There is a place for looking at needs and moving forward in training and what you're going to do over the next 12 months. But I think it's just kind of going through some of that again. Again, something that we take feedback on every year and try and tweak when things are needed. So the other thing that we tried to look at was a stress risk assessment. Now, I don't do stress risk assessments often, but they're awful. They're dead stressful to do, and I don't get anything out of it. Our members come back from occupational health. Oh, you need a stress risk assessment, and then they say, they want support in it because they're worried about the stress risk assessment with the manager. And that doesn't work, does it? So what we've done is we've tried to change some of that guidance that we've put with it. They're using more of the language that we use in my yearly conversation to try and, instead of just saying to someone, are you stressed? Yes, trying to tease out what it is that the problem is and how can the trust support them, rather than just a yes no kind of tick box. So that's something that we are trying to work on at the moment, but there's some resistance from moving away from the traditional HSE form because of worried about them ended up in a tribunal and saying, why didn't you use the form? Well, it's rubbish. Yeah, but that's the form. So we're trying to add guidance to it rather than change the form at the moment. But if anyone has any good examples of stress risk assessments where that approach is taken, and then please do let me know, because we're always looking for something that's a bit better. That's being used, that we can say, no, it's being used, it's okay, it's doing that. The other thing we do, we've got, I'm sure you all have, Freedom to Speak Up Guardian. I knew Freedom to Speak Up Guardian used to be a union rep, so it's much easier to do this now. And what we found was, people would come maybe to Unison, one person on a ward, one person would go to the RCN, two people might go to Freedom to Speak Up Guardian, one person might phone up HR. We all knew that one person had an issue on that ward, but nobody knew that actually most of the ward was phoning different people to bring the same issue forward. And we started to doing some triangulation work. Now, it's reasonably difficult to do because of your confidentiality on everybody's side. But what it's done is it's brought information from non-trade union members, trade union members, people who've gone to the Freedom to Speak Up Guardian, and we've brought it together and identified where there are some issues. And one recent place that we did this in, we've had a massive project there with the OL&D, with the directors. We've run workshops, training. There was some massive issues that were affecting staff. Sickness was really high. Most people are back in work now, and it's pretty stable for the first time in a few years, really. But that's because of the work that we've been able to do by, again, having those conversations and understanding that where people are speaking up. And again, it got to a point where it was really bad before people started to tell us. I think what this proved to everybody is if we'd have found out earlier on, we could have done something about it without, you know, having all of this absence and this stress absence that people were off with. So that's and that's something that we are trying to do a little bit more of within those areas. And the absence management policy. So absence management policy is always the one that we get 30 managers turning up to our policy review meeting to talk about anything else, and not one of them turns up. And everybody wants to know how this policy is going to make them be able to manage one person in work who they think is taking the mick. Not about the 95% of people who are in work. So there's a real push at the moment within the Greater Manchester area, as well as kind of in the trust, to start to flip absence management on its head. And if you look after the 95, why are we spending so much time sanctioning people, 5% of our workforce, when actually 95% of our workforce are in work and maybe not getting the support that they need? So how do we make the 95% stay in work? And how do we encourage those to come back in? You'll always have some people who are off sick, but we know that sanctions don't work. We know that they just create an unhealthy atmosphere. It develops, you know, we know we've got an issue with presenteeism, and I think it's more now with people working from home, because people might have been too ill to go into an office, but they'll drag themselves to the desk at home and sit there and cough and splutter all over the keyboard, where they wouldn't have done that in an office full of people. So I often speak to people who are probably too unwell to work, but because they think they're sat in the house, they come in. So, you know, I think there is that push within it again to radically change that policy. We're not there yet, but the conversations are happening. And as I say, in Greater Manchester area as a whole, all of the trusts are having that conversation about how do we do this on quite a wide scale, really. How do we change our emphasis and support staff? Because I think if everybody does it, it's much easier to do than people jumping from trust to trust because they've got different policies in this and that. And there's a recognition of some of that now, that all people do is when they leave a trust, they just go to another one round the corner and jump around. And actually, let's work as a bit more of an economy. So we are hoping that we will be able to start to get rid of some of that what the word is, authoritarianism of absence management. But we will see. We are trying. Okay, so if we move on, oh, it's not good, is it? We've got another one there, is it not? Is it not working? Crikey, we've lost some of our. So I think the next one would have been where kind of what have we learned, really. So there we go. What have we learned? How has this changed? You know, for staff, for patient care, for, you know, and what are the good parts and the bad parts of just culture for me? So I think, you know, the good things, there should be better managers, better equipped managers. We should have happier staff. They should feel safer in work. We should have safer environments. We all know of areas that are not the safest places to work before they even start. and finding those areas and putting them right. And all of those things should lead to better patient care, which is at the end of the day why we're all here. And I think that that's what we would always aim for. But I think that you have to improve lives for the staff to improve that patient care. I think the bad, it's hard to change a culture, and you pretty much are reliant on everyone acting in the same way. You're reliant on managers taking this up, understanding it, and being able to sometimes I think it's have the confidence to have conversations with staff. I think that's sometimes part of the problem, that people don't always have the time or the confidence to sit down and have some of these conversations. They just want to bat them off. Go and speak to your trade union, go and speak to HR. We need to make sure that people feel that they can speak up early, because this doesn't work if people don't have that. We are looking at the moment about looking at different ways to train new managers on this new culture. At the moment, we've been talking about this week, myself, our learning department, Freedom to Speak Up, and our EDI lead, having some short sessions that we record like this, with all of us talking about certain topics, and try and have these little bite-sized bits that we can use to train up new managers, that new managers can go to and use, and look at the way that we talk about incidents, the way we talk about different things, and what we would expect, and when to raise things as well outside of those areas, because I think managers sometimes don't always have the confidence to raise things, and you get that thing, don't you, where senior managers go, right, this is great, and it hits this, and then staff go, this is great, and it hits, and it stays there, and none of those messages actually get that this isn't working, doesn't go up, and that this isn't working, doesn't come down. And you get that layer of manager, and they're just like sponges, and they soak up all their issues, and then there's a problem. So it's making sure that we get past that, which again I think is difficult. And I think the misconceptions of it, and just culture being used in the wrong way. There'll always someone saying to me, oh, it's all right, we've dealt with it under just culture. What does that mean? What did you do? Then there's lots of oohing and ahhing and erming. And then you find out they've just shouted at staff, say don't do it again. Probably tell them they've got a warning and going to put it on your file. And they've done nothing else. They haven't actually done just culture. They just sometimes see it as a way of brushing things under the carpet. There was an infection control breach recently, and they just wanted to pull all the staff in, tell them off, give them a warning, not actually find out what happened, because people wouldn't have been open to being there, because there was only so many people we knew, because it was shared on Facebook. So people in the pictures were clearly there at this gathering, but there was lots of people who were there that would have just said no, I wasn't there, if we thought they'd get a warning for it. So I was like, no, we're not doing it like that. We have to investigate it properly and figure out what went wrong. And they just went back and said, oh, we wanted to use just culture, but the trade unions wouldn't let us. And I'm like, no, let's use a proper, you can't just do that. And that is the problem, that the investigation came up with recommendations, better outcome, no warnings on file, it's never happened again. The staff know, they've had some training. It was just reminding them that someone might have been leaving who'd been there for 30 years, but actually we're still in the middle of COVID. So it's about making sure that people don't use it in the wrong way. And I think that's a real problem that I think you can do, people using it as a way of getting round rules. So if we just, last slide, thank you very much. So I really hope that was useful. It's very odd talking. I think you think I'd be used to it by now after all this time, but it still is very odd to see to do things this way. But yeah, if there is any questions, I can do my best to help, to answer, or we can go away and find those out.
Thanks, Michelle. That's really excellent presentation. I've got a bit of feedback now. I know some people want to come in. Just to mention in the chat box, lots of endorsement for your example of the Sully film, showing how systemic sort of investigatory frameworks can actually penalise individuals and fail to learn anything. And Mike tells us that it's available on BBC iPlayer for anyone that hasn't seen it and wants to. So I'm going to call on people that are indicating to speak, and our first person is Mike, actually.
Sorry, I don't think I had my hand raised.
Oh, maybe I'm looking at the thumbs up. I'm a bit low tech on these things. Sorry, wait a minute. Yeah, oh, you're right. It's Peter. Come in, Peter. Sorry about that.
Thank you. Thanks, Michelle. Good to see you again, and that was really interesting, and actually largely reassuring that we're probably in Wales moving in a similar direction, and I really get what you're saying about the positives and the negatives. I just wondered if you had any advice, or indeed if anybody else on the call does, about my organisation. Like you said, this has been knocking around for quite some time now, and people are quite enthused and excited by it, aren't they? And my organisation has started saying that it does the just and learning culture without actually having had an away day like you had, or bringing Michael West in, or I just kind of wonder what is the standard, if you like, by which you can sort of legitimately say this is something that we've embraced and adored. Part of me feels like say, well, no, actually you don't. You're just saying you do it, but you haven't actually sort of formally, I don't know, put out a policy statement or launched it or anything like that. It's just creeping into the jargon.
Yeah.
Do you see what I mean?
Yeah, thanks, Peter. Because we're sort of strapped for time, I'll take another couple of questions, and then perhaps you can answer them in a sort of group. Is that okay, Michelle? So the next we've got Suzanne Smith. Come in, Suzanne.
I just wondered how you managed to disseminate the idea of just culture beyond like your senior managers. Has it gone down to staff so they understand as well? Because quite often it's your lower level management. There's got so many people who've had management responsibility devolved onto them without necessarily the training, and I just wondered whether that the stuff that you actually put out for staff to understand what you're trying to achieve, so that they can kind of think, is this right?
Thanks, Suzanne. And we've got Mike next.
Yeah, just to say, I think the problem is really deep. Even when an organisation does adopt the idea, and I mean, in our trust, they've adopted the idea of a kind of learning culture, and they've integrated it even into the training that managers are given. But there are still managers out there who, frankly, just shouldn't even be in the job. And I suspect that the reason they're there is because they didn't have the people skills to be therapists in the first place. So we really still have to be totally on the ball in terms of making sure that they stick to it. It's a really big, deep-rooted problem that even the best policy doesn't seem to solve.
Thanks, Mike. I'll take Fiona next, and then we'll go back to Michelle for some responses. Fiona.
Yeah, it's just to say that at East Lancs we're very, very similar to Pennine, because we have the resolution. Staff side are very, very heavily involved in writing policies. And the issue we've had early resolution for quite some time, but the issue we have at the moment are managers having facilitated conversations with staff. And we've got one at the moment that's had 4 facilitated conversations, and there's that much damage that's been done. Even the trained mediators that we have in the trust have said there's no chance mediation can sort this out. So it's managers learn, there's a massive impact on facilitated conversations, and facilitated conversations really need to be defined about what they are.
I would say that we may have not stolen some of Fiona's policy, early resolution policy. And if I'd have seen her on the call, I might have admitted that a little bit sooner. But yeah, it's much more front loaded than ours though. It scared me, your policy. I was like, no, I'm not sure about this. But I think you're right. I think, you know, you're right there, Mike. Fiona, I think you're absolutely right. I think you are. Anything like this is kind of tends to be judged by the lowest common denominator, and there tend to be managers who don't want to. But I think what it does do is it does give us a tool to go back. It gives us a tool to raise it a little bit more than the policies that we had before. It does, in a way, kind of highlight some of those poor managers, and gives us somewhere to go with it. And I think we would use that in that way, really, to actually, you know, there are massive amount of comms that go on in our trust around the just culture, but also about our trust values, which are like fairness, and you know, things like that. So they tie into this. So I think that, as Suzanne, I think you said, I think that's part of that, is tying it into what the staff know every day. So I think that everybody who works in the trust, from right, you know, that there's communications around the you know, our values, and around how that fits in with that just culture. And I think that there's sometimes, I think that I don't know whether they need to know that we're working in a just culture, but they need to know that they're working in a fair, safe environment, that they can raise questions and issues. I think that that for me is more important than them just having a buzzword, like you say, Peter, that says, oh well, we've got just culture. I'd rather that people felt that they had a safe environment, and a manager that could support them if needed. I think that's for me is more important than those buzzwords. And I think you have to demonstrate, Peter, what's changed that means that's, I suppose, that is just that you're working in this sort of environment. What's changed to do that? How have, you know, can you use it to your advantage when you want to make changes in policy, in investigations, in the way that the staff side want to make changes, to use that? Well, you say you're working in just, you know, in a just culture, and kind of use that as a tool, really, to make changes, which is, you know, the managers are very good, aren't they, at saying to us, well, we're doing this because of that, and we don't always have something to come back on them with. But I think that the just culture stuff is, if they're saying it very loud, it gives us an absolute avenue to come back into them and say, well, prove it by doing this. So I think you Peter, I think what you're saying, I think is lots of, you know, I think that you're going to usually have them lower level managers doing that. Oh yeah, no, and they say, oh, we're doing this, we're doing it just culture, and staff go, all right, okay, it must be all right then. But actually, what does that mean? And it is challenging that. What does that mean? How are you doing that in a just culture? That's one of the things that we do a lot. That's how we kind of challenge back or demonstrate how you're doing that.
Thanks, Michelle.
I don't think there is anything. No, I don't think there's a kite mark. I don't think there's a. Maybe we should make one. Maybe we should make up a sticker that they get if they're doing it. Unison just culture.
But I think it is. People have said how massively challenging it is, and you know, the good work that you've done is kind of, you know, you have to keep on with it. It's a continuous process, isn't it? People join and leave, and you know, that learning how things need to evolve. It's kind of, you've got to keep at it, keep educating people, keep pushing that. But it is a win-win, because you know, if people are happy at work, then that's sorted the sort of employees' retention issues. People won't want to leave. You know, but it does require a huge amount of work, I think. One of the things, when I was sort of reading around it, looking at NHS England's website, there's a couple of case studies, but you know, it seems like there needs to be loads of case studies, needs to be dozens. I wonder whether you have any on your sort of Pennine intranet that you know, that staff and managers can dip into to see, you know, this is what just culture looks like, because that's kind of quite powerful, isn't it?
Yeah, we don't at the moment. That's kind of why we're starting to have the conversations about these video clips of us talking. We thought that might be an easier way than somebody reading it, hearing it coming from different points as well. So what HR is saying, what EDI is saying, what I'm saying, so that they see that with the different way that we talk about it, we're all talking about the same thing.
Yeah, I think that'd be really, really powerful.
That's next on the list.
Okay, well, look, it's 12:01. I want to say thank you so much for such a brilliant presentation, so much food for thought, and obviously we've picked up in some of the contributions that there is work going on in other trusts around the UK. I think there's something we'd like to take back to the National Stewards Panel and have a further conversation and find ways to share good practice, because it's so important. I'd just like to thank everyone for attending, and hope to see some of you at this afternoon's sessions, and starting back at 2 o'clock. So thank you so much, Michelle. Big round of applause. It's lovely to see you.
Thank you. It's lovely to see you all, and it's lovely to catch up in a virtual way, but lovely to see. So it's very nice when you come on something, you see some smiling, welcoming faces.
Oh, we'll take care.
All right, thank you very much. Thanks for your time, everyone. See you. Bye-bye.
See you later.
Bye-bye.
See you soon.
Bye-bye.
See you later.
Bye-bye.